All diagnostic specimens must be properly packaged and shipped according to international regulations for the transport of dangerous goods and potentially infectious materials. These regulations have been put in place by the United Nations Committee of Experts on the Transport of Dangerous Goods, the International Air Transportation Association, or IATA, for international shipment, and the U.S. Department of Transportation within the United States. As the shipper, it's your legal responsibility to adhere to these regulations. Following these regulations also helps to ensure that specimens arrive at the laboratory in good condition, optimizing diagnostic results. Shippers must pass a certification exam in order to be qualified to ship dangerous goods. Recertification must take place every 2 years. This video will provide some basic guidelines in how to properly categorize, package, and ship patient specimens to the diagnostic laboratory. However, this video is not intended to be a substitute for the IATA training program. Patient specimens include items such as tissue samples, tissue swabs, body parts, excreta, secreta, blood samples, and specimens in transport media like swabs, culture media, and blood culture bottles. These specimens may potentially contain infectious substances and must therefore be categorized, packed, and labeled appropriately before shipment. There are 3 categories of materials: Category A, Category B, and unregulated samples. Unregulated samples are patient specimens that are not expected to contain infectious agents. Specimens like serum samples from healthy animals and hair samples for genetic testing can be packaged in appropriate leak-proof triple packaging and labeled Exempt Animal Specimen for shipment. Category A samples are capable of causing permanent disability, life-threatening, or fatal disease in humans or animals. For a current list of Category A select agents, consult the following online resource from the USDA. All Category A substances require special-rated triple packaging, labeling, and documentation. Most specimens collected as part of an avian disease investigation or infectious disease outbreak will not be Category A substances. However, if you think you need to ship Category A substances, you must seek the assistance of your regional veterinary authority first. Category B samples include substances that may be or are known to be infectious but do not meet the criteria for Category A. Most veterinary diagnostic specimens fall within Category B. We will now demonstrate how to package and ship Category B samples to the diagnostic laboratory. Preparing formalin-fixed samples. Tissue samples destined for histopathology should be trimmed to no more than 0.25 centimeters thick. Place the tissues into a large jar filled with 10% formalin. Use a 10-to-1 ratio of formalin to tissue volume to fix the tissues. After 24 hours, the samples will be fully fixed and can be moved to smaller leak-proof containers for shipping. Small jars with screw-top lids or sealable plastic bags work well for shipping. Fill the containers with just enough formalin to keep the tissues moist during transport. Keep in mind that the total volume of 10% formalin in the entire shipping container should not exceed 30 milliliters. Packages that contain more than 30 milliliters of 10% formalin require special labeling, documentation, and other pre-arrangements, and are therefore best avoided. For more information on how to send shipments exceeding 30 milliliters of 10% formalin, consult the following IATA resource available online. Packaging samples. Assemble all the diagnostic samples, such as tissues fixed in formalin, fresh tissue samples, culturettes, blood tubes, and fecal samples. Check that all the samples are tightly sealed in their primary leak-proof containers. Be certain that all containers are labeled with the tissue type, date, and any relevant farm or flock information. Next, place the primary containers inside sealable plastic bags or rigid secondary containers. Fragile items like glass tubes should be protected with padding material before being placed inside the secondary containers. Place absorbent material, capable of absorbing the entire liquid contents, inside the secondary containers and seal them tightly. If the shipment will be sent by air, secondary containers must be placed inside an approved, insulated, waterproof, flexible, or rigid shipping container. These containers are capable of withstanding aircraft cargo pressure changes and are rated to an internal pressure of 95 kPa. Approved rigid containers and rated leak-proof pouches are available from several commercial vendors in a variety of sizes. Next, place frozen ice packs inside the shipping container to preserve the specimens during transit. Avoid sending diagnostic specimens on dry ice. There are numerous restrictions for shipping dry ice, and gases released by dry ice can damage some specimens. Put the case history and submission forms inside a sealed plastic envelope and place the envelope inside the shipping container. Seal the shipping container. The sender and recipient's name, address, and phone number must be legibly printed on the outer package. Label the package with Biological Substance Category B and affix a UN 3373 diamond label to the outside of the container. Many commercial vendors provide these labels. Cover all labels and printed areas with clear plastic tape to prevent the ink from running if exposed to moisture. If the package will be sent to an international reference laboratory, additional permits and shipping labels are required. Consult the foreign laboratory in advance to obtain an import permit for clearing customs upon arrival. Copies of the import permits should be affixed to the outside of the box using an outside pouch. For air cargo shipments, note that there are size and weight limits for these packages. The primary containers cannot exceed 1 liter or 4 kilograms of solids, and the entire package cannot exceed 4 liters or 4 kilograms. If you wish to ship body parts, organs, or whole bodies which exceed these weight limits, you will need to seek a special provision A82. On the waybill accompanying the shipment, include the following note. To ensure the arrival of high-quality specimens at the diagnostic laboratory, it's advisable to ship your packages using overnight delivery.